My name's Kaitlyn Hildebrand, and today I'm going to be talking about the integumentary system. For this video, I'm going to be using these 3 flashcards, and here's the back of them. And we're going to start off talking about what the integumentary system is made of and its main functions. So it is made of skin, hair, nails, and sensory receptors, and the main functions of this system are to provide protection to the internal body, as well as maintain homeostasis, such as regulating temperature, and then it also provides sensation and allows for emotional communication through facial expressions. There's 3 main layers of the integumentary system, and this is the epidermis, the dermis, and the hypodermis, and we'll go into all of those 3 in detail throughout this video. So we're first going to look at the epidermis, which is made of epithelial tissue. So this is the top layer of the integumentary system. There are 4 main cells that are in the epidermis. These are keratinocytes, which create keratin, which is a really important protein in the body, as well as melanocytes, which create melatonin. This allows for skin color and also provides UV protection. Dendritic cells, which fight infection and help keep the immune system going in the body, as well as tactile epithelial cells. These tactile cells allow for sensation by working with nerves to provide sensation in the body. The main layers of the epidermis, starting at the bottom, we have the stratum basale. So this layer has keratinocytes, melanocytes, and tactile epithelial cells. There's lots of nutrition here and nutrients because it's at the bottom, right butting up to the next bottom layer, the dermis, the connective tissue of the integumentary system. So a lot of the cells can divide and grow. Moving on, we have the stratum spinosum. This is an area where keratinocytes divide and grow a lot. Dendritic cells are present here, and they're fighting infection, providing immunity. Moving up, we have the stratum granulosum. This area is where keratinocytes begin to harden and die. And then moving on, we have the stratum lucidum. This is only present in thick skin, such as the palm of your hand or the sole of your foot. And this layer is a thin, clear layer where there are dead cells. And then finally, we have the stratum corneum, and this is a layer of dead cells. The cells begin to shed off. This is the top layer of your skin. And then moving on past the epidermis, we have the dermis, which is made of connective tissue. The 2 layers in that are the papillary and the reticular. In the papillary, we have touch receptors, capillaries, and lymphatic vessels. And then in the reticular, we have friction ridges, which provide grip, as well as fingerprints, provides different ridges within your skin. There's also cleavage lines. These are invisible lines, but if you cut parallel to these lines, it allows the skin to heal a lot faster with less scarring. So this is really important for surgeons to know when they're planning a surgery. In this area, there's also hair follicles and sweat and oil glands. And in the reticular layer, there's a net-like web of collagen that allows for stretching of the skin. Below the dermis, we have the hypodermis. This is made of subcutaneous fat. This allows for shock absorption, insulation, and fat storage. This is really important because below this we have muscle or bone. So this allows for extra protection of that muscle and bone and absorbing that shock. I'm going into physical therapy. So thinking about this system and why it would be important for a physical therapist to know, I was thinking about wound care as far as physical therapy is concerned. And it's really important to understand the different layers and how each layer would be affected by a wound, particularly with burns, like if it has touched into sensory receptors or if it's just superficial. So knowing that and knowing how to help your patient and move forward is super important. For this video, I used the Anatomy Pearson 9th edition textbook, as well as Pearson's anatomy channels and Kahn Academy. I have linked those sources to the bottom of this video, so you can find those there. Thank you so much for listening.